Welcome to the Rhythmic Movement Training Program videos. My name is Allie Davidson and I'm a student at the Doctor of Occupational Therapy program at East Tennessee State University. For my capstone dissemination, I have developed a rhythmic movement training program for the patients here at Encompass Health of Kingsport. This program is designed to meet the needs of various diagnoses and precautions. Each movement and each routine is strategically placed depending on the diagnosis or precaution. If at any point during the session that there are complaints of fatigue or need an extended rest break, please implement that for the patient or stop the session if needed. For the rhythmic movement program, there are several inclusion and exclusion criteria required for participants in each session. Inclusion criteria include being able to follow two-step commands, they are medically stable, they are able to express needs verbally or non-verbally, they have adequate receptive communication, and they are agreeable and able to consent to the session. Exclusion criteria are as follows: the inability to follow two-step commands, they have severe confusion or delirium that prevents safe participation, they are medically unstable, and there is active agitation or aggression that disrupts the group dynamic. Before beginning the rhythmic movement program, there are a couple things that you need to remember. Before beginning a session, you need to collaborate with nursing on the patient's status and medical stability. If there is any change in status or the patient is medically unstable, they are not qualified to participate in a session. Before beginning the program, you'll also want to verify your patient's ability to follow two-step commands. It is a requirement as part of the program for patients to be able to follow two-step commands. You also want to confirm that the patient has sufficient sitting balance when upright in a wheelchair. Without this, they are unable to complete a session. You also want to ensure that the patient participating has appropriate behaviors for group. Also, before beginning, you want to arrange the wheelchairs in a semicircle formation. You also want to ensure that the music is at an appropriate volume for those participating. During the session, you can adjust the patients if needed if there is limited visibility or hard of hearing limitations. During the session, you want to start the movement slow and gradually increase intensity and speed as the session goes along. As a therapist, you want to continuously monitor for physiological, neurological, or behavior changes. As needed, grade movements for patients. For example, if a tempo is too fast for a patient and they are unable to keep up, then you can use 2 counts instead of 1 count for movements, or more if needed. No matter what, do not leave the group unattended. If needed, stop the session immediately if an emergency arises. Towards the end of the session, gradually reduce the music and the tempo of the movements. Once the session has concluded, you want to place the footrest back on the wheelchair for the patient. You also want to ensure all chair alarms are present and activated for those who need it. Once you have ensured that the footrests are back on and that the chair alarms are active if needed, prepare the patient for their next therapy or return the patient to their rooms. Once the patient is where they need to go, document on their performance during the group session. If needed, notify nursing of any changes that started during the group. Without further ado, let's begin our sessions.